Dr. Niranjan, consultant laparoscopic and bariatric surgeon at United Hospital, Bangalore. Today I will be discussing about the topic of hernia. Hernia can be there at multiple sites. Hernia is not a disease, but it's a defect in the abdominal wall. Commonest types of hernias are inguinal hernias, where the hernias will be there in the groin area. And the other site of hernias are umbilicus as well as the incisional hernias, where the hernias can come in the site of incision where they have undergone previous surgeries, like for cesarean or for any other laparotomy procedures where the abdomen would have been opened, or like tubectomy. So in those scenarios, the surgery can be done via two methods. One is a classical conventional surgery by cutting open, which is called as open procedure. The other procedure is called as laparoscopic hernia surgeries. The facility for laparoscopic hernia surgeries is available at United Hospital, and you can come and consult me in United Hospital for undergoing the same procedures. The advantages of laparoscopic hernia repairs are they are minimally invasive, less amount of pain, less amount of scar, and faster recovery. Thank you.